So on to our presentation for basics of asthma management for children. Our presenters are from UCSF Benioff Children's Hospital, and just a little bit of information, about these presenters. Lourdes Juarez is a certified pediatric nurse practitioner whose career has been dedicated to working with the most vulnerable communities. She has cared for young children and adolescents with early onset of chronic disease, including pediatric obesity. She provides care to the homeless, immigrant, asthma, and underserved pediatric populations in primary care and divides her time on grant projects focused on adverse childhood experiences, trauma-informed care, and the Center of Excellence on Immigrant Child Health and Wellbeing. As part of the COE, she coordinates the Pediatric Asylum Clinic, the UCSF Pediatric Human Rights Collaborative for East Bay. She has been a clinical preceptor for UCSF PNP graduate students and is a mentor to undergrad students majoring in nursing, nutrition, or healthcare in general. Many of her mentees are underrepresented groups who are first generation like herself to college or have been historically underrepresented in healthcare. She works at UCSF Benioff Children's Hospital, Oakland Primary Clinic, and is a UCSF Assistant Clinical Professor from the School of Nursing. She received her Master of Nursing degree from UCSF and Bachelor of Nursing from UCLA. Roberto Mock has obtained his LVN in 2005. He started as a clinical nurse at UCSF Benioff Children's Hospital, Oakland Claremont Primary Clinic in February of 2006 before transitioning to the asthma team. His focus has been on providing comprehensive asthma education for both inpatient and outpatient settings as a certified asthma educator. He is deeply committed to empowering patients and educating medical residents on asthma management. Beyond his clinical responsibilities, he has also served as a lead clinical research coordinator and research nurse, overseeing a dedicated team of 4. Together, they are engaged in a variety of research studies spanning on areas such as vaccines, asthma, and social determinants. At this time, his primary focus lies on projects such as ORBEX, Pearls, CARE, Eagle, and HERO, each contributing valuable insights into asthma and adverse childhood experiences. Please join me in welcoming Lourdes Juarez and Roberto Mock. Thank you for joining us today.
Good morning. Muy buenos días. We're so excited to be here presenting on a topic that both Robert and I feel very passionate for. And we feel so much needed in our communities, right? So thank you very much for inviting us. Robert?
I'm so happy to be here, and hopefully you get something out of us, and because we like to share.
Yes. So, before we get started, we want to know a little bit like who is here. If you could please type in the name of your organization, your institution that you work for, or perhaps volunteer, along with the city. Please, I just want to get just a general idea of who's here. That'll be very helpful.
And also, you can let us know what are your expectations from this, I guess, presentation.
Great, thank you for being the first one. Thank you. So, Johnny George from Lincoln Family, City of Berkeley Public Health. Great, thank you. Oakland, yes. We saw that some people were also from out of state too. So want to welcome those folks too. Great, good morning. Okay. Alejandra from Alameda County City Foster Family Services, Family Care, great. Oh, thank you for joining and mentioning you worked at FGC, thank you. And thank you for your work at helping us too. Okay, a health navigator, Oli Diaz, great. Contra Costa County Community Service Bureau Head Start. Okay, great. Well, thank you. So keep adding as we go along in our conversation. We want to make sure that today's talk is, feel free to ask any questions in between, right? We will try to answer as much as possible between our talk. We don't want to wait towards at the end to have any questions. We want to make sure it's interactive. You know, when we talk to families and we provide education, we love questions, you know, and we try to answer as much as possible. So please feel free to ask any questions in the chat, and we'll try to pause and answer those questions as we go along the way. Okay, and Kimberly Emily from Children's Center, perfect. Great. So then I'm going to advance to the next slide. Okay, so our objectives for today is describing the biology and the scientific symptoms and the common triggers of asthma in children. We'll also talk about the difference between rescue and controller asthma medications. We'll also describe some of the asthma devices, techniques, and maintenance, and also discuss how to advocate for your child's asthma within our communities. Okay, sorry about that. Okay. If you were in person right now, I would ask you to do an activity. So I would like you to just kind of pretend for a moment that you're in person with me. I'm going to ask you to stand up, yep, right? And I would give you a straw. I would give you a regular straw, not a boba straw, right? Because the boba straws are a lot bigger, but I would give you a regular straw and would ask you to put it in your mouth, okay? And in your mouth, then I would like you to breathe through the mouth while you're jogging in place, jumping up and down for 30 seconds, right? So you're breathing, imagine you're breathing through that tooth. So imagine how your breath is coming in and out, right? In and out, not that smoothly. Of course, if you had any asthma, symptoms or even a respiratory illness, I would not ask you to do that, right? So then this happens, when you're doing as someone who's having an asthma episode, it's hard to breathe, right? So yes. So let me go to the next slide and then we'll come back to that. But before that, we will have a polling question. So Leah? So our first question is, both kids and adults can die from asthma, especially if it's poorly controlled. True or false?
All right. You want to give the answer, Lourdes?
Okay, great.
Let's,
I'm sorry. Perfect. Your result. Okay.
so we
Great.
have 100% that they're saying that is true. Is that a
Okay,
correct
great.
answer, Lourdes?
Yes, it is true. Thank you. Yes, yes. You could have a fatal response if your asthma is not well controlled. Yes, yes. Another question that I forgot to kind of mention, is what do you hope for in learning from today's talk? If you could write that in your chat, what are you hoping and anticipating for learning from today's talk? Some of you did the pre-survey, so we appreciate that. We're taking all that information into account for today's talk, so thank you. Anyone would like to say something what they're hoping? I think some of the responses in the pre-survey was they were hoping to learn more about asthma. They were also hoping to learning about some more organic house cleaning supplies information. What else did they ask, Robert?
Actually, before that, I wanted to give you a sense of where we got this the questions from the polling. It is from a quiz that we give to inpatients at Children's Hospital here in Oakland. Any parents with kids that are hospitalized with asthma, they get to take a quiz about their knowledge of asthma, and these are some of the questions that they ask on that particular quiz. And it's just, I guess, the nurses over there use that to gauge, to see what knowledge they have, and then they're able to provide some education and answer to any other question that they may have.
Okay, so and please feel free to write in the chat anything that you would like to hope to learn from today's talk. So we want to make sure we address your questions or concerns too as well. Okay, we'll go to the next slide. Okay. Okay, so if we look at asthma national stats across racial, ethnic, and
Okay,
also,
this one.
sorry, I think we're having trouble with the slides.
Okay.
I'm gonna advance. There we go, the right side. Sorry about that. Okay, so if we look at asthma national stats across racial, ethnic, and socioeconomic groups, it's more common among African American groups, Latinos, and Native Americans who live in poor urban areas. the rates of asthma-related ER visits in African-American children as compared to Caucasian counterpart is 4.5 times higher for ER visits and 7 times higher for death. African-American adults are 2.8 times higher for ER visits and 3 times higher for deaths as compared to their Caucasian counterparts, as well as Latino children. We see similarities of like 2.1 times higher to visits in ER and 2 times higher for death. Native Americans are 30% likely to have asthma, with a 20% higher rate of having asthma-related deaths. And minority children are less likely to take asthma medication. And we also see a 2 times greater, rates of asthma in the Puerto Rican communities, as compared to other Hispanic populations. Now, if we look at the asthma ER rates in Alameda County, we have similar results to the national stats. Blacks having more ER visits and slightly exceeding the California asthma rate, and Native Hawaiian Pacific Islanders exceeding by far the California rates for asthma. These numbers are per 100,000 residents. Interesting, if you look at the ages, we see there's a higher number of rates for ER visits among the 0 to 4 years old. And yes, we in Alameda County exceeding or passing the California rates. When it comes to hospitalizations in Alameda County by age and race, again, we see that the 0 to 4 years old have among the highest rates in being hospitalized due to asthma, along with the Native Hawaiian Pacific Islanders and Blacks as being specific ethnic groups to be more likely in the hospitals. What does this mean for our infants, toddlers, and young children, and organizations that interact with these young children daily? Let's go for the next polling question. Okay, so this question, what happens in the lungs during an asthma attack or flare-up? Yes, okay, so most of you answered D, all the above. Yes, great, thank you. Yes, what happens is all the above. The lining of the airways get swollen, thick mucus forms, and the muscles around the airways tightening and making the airway smaller. Thank you for answering that. Most of you got it right, perfect. Okay, so the exercise that I explained earlier about breathing through the straw and doing jumping jacks and jumping up and down, for me, I've done it, most of the time. It's hard. I don't have asthma. I'm blessed not having asthma, but I imagine that it's very difficult to breathe if you would have an asthma episode, right? And breathing through the straw. So asthma is a disease that affects your airways, your breathing tubes. You have your trachea, right? As you can see, your windpipe. Next, you have your bronchi, your big airways. And then you have your bronchioles, which are your smaller airways. And your alveoli, which are your small little air sacs, the ones that are at the end of like the little branches, right? In a normal airway, air that you inhale and exhale come in and out smoothly, right? So you see the little drawing of the normal airway. And in airway with an asthma episode or an asthma exacerbation, there's swelling, there's mucus production, tightening of the muscles around the air tubes, and your air is trapped in the tiny air sac, which makes it so difficult to breathe, just like in the straw activity that we pretended to do. That is asthma. Okay, let's talk about signs and symptoms. Okay, before that, of course, we have another question. What are the common asthma symptoms? Okay, I think I'm gonna stop the questions here. Okay, and share results. Great, so happy to know that you guys picked all the symptoms except for C. Thank you. Okay, so let's talk a little bit more about these symptoms. Okay, so the common signs and symptoms of asthma will be the cough and wheezing, right? And I have the symptoms in red, and those are more of the red zone, symptoms. The one we say that they're high alert, ones that you're having more respiratory problems or distress, right? The trouble breathing, the shortness of breath, the retractions, the chest tightness, and the nasal flaring. Associate symptoms will be fatigue and tiredness, right? And I say the associate symptoms because kids always say there's a symptom that happens before they have the cough and wheeze, and definitely before all the red zone symptoms. They might complain of body aches, a sore throat, have a headache, or maybe start having a cold, or maybe start eating, not having much of an appetite or not playing as much because that something's going to come. And then allergies, which I highlighted in yellow, is that sometimes when you have allergies and asthma, allergies is a trigger to have your asthma symptoms get started. So we need to have that allergy symptoms controlled in order so one doesn't exacerbate your asthma symptoms that much. So kids are always giving you signs of symptoms. I remember doing an education back in my earlier years, and that was my first connection in terms of asthma, right? In the asthma education world, coming from my profession, we had done some asthma education in Boyle Heights area in LA County, and we did a basic education. We had parents and children separated, and we gave them a body map, and we asked the child, that's why we asked the parent, what is the first signs that your symptoms that your child's going to get sick of their asthma? And then we asked the parent and the child to come together to share what they said. Most of the time, the first symptom that the child will say is the associated symptoms, like maybe a headache, my feet, I get tired. And the parents will say a cough and wheeze. It was an eye-opening for these parents to see that the first symptom that the child had was different from what they had. And they felt really bad and said, oh my God. So that helped their communication to talk about what happens when the child starts to get sick. So pay attention to those symptoms. And as daycare people, as teachers, you're there with your kids most of the time, and you know them very well, and you could tell when a child is starting to get sick. So yes, please share those information to their caregiver. Okay, so what do these symptoms look like? Start playing this.
It feels like I can't catch my breath.
I can't stop coughing.
I'm losing all the time.
My stomach hurts.
My chest hurts.
Babies and toddlers can't tell us what is wrong and may be more fussy than usual, or not want to feed during an asthma attack. During a severe attack, babies may be more sleepy than usual. Cyanosis, or a blue tinge to the lips, is a late and concerning sign. Remember, early in an asthma attack, you might have coughing, wheezing, or chest tightness. But if the asthma attack becomes severe, you will have a hard time breathing. Sam is having trouble breathing during a severe asthma attack. He is breathing fast, breathing with his belly, having chest retractions, nasal flaring, and grunting. We just showed you what happens during an asthma attack, but even when you are not having an asthma attack, you may have mild symptoms indicating that your asthma is not well controlled. Nighttime coughing is particularly common. Coughing with exertion is another common sign. You should talk to your doctor if you are experiencing any of these problems.
Okay, thank you. So you saw that little baby having retractions. You saw the young girl coughing, constantly coughing, hacking that cough that just, goes and goes. Definitely these are children experiencing asthma symptoms, of course, different ages, but there are experiencing symptoms that are, quite moderate to severe here. So let's see. Another common symptom that we want to make sure that you're able to hear and see. Sorry, I'm having a little bit of a delay here. Okay, yes. So let's look at this video. I'm not quite sure we heard the sound on that one. I just heard a little bit. Could you try to play it again, Robert?
You can, little one.
Okay, so you see this kid like breathing in and out. See the upper part of his abdomen, he's kind of sucking in and out, you know. So those like kind of those are what you call retractions. If you heard at the beginning of the video, you heard that that's the wheezing sound, right? People describe it as a cat, you know, as a whistling sound. If you hear that, you know, that just keeps, you know, those is very classic wheezing sound, and we want to make sure we play that, you know, because parents sometimes get confused what is wheezing, right? So, thank you, Robert. Let's go to the next slide. Any questions, please? Make sure you put any questions if you have about anything that we're talking about. I think it's not advancing. Okay, so now we're going to talk about common asthma triggers. Robert?
Yes, hi everybody. So these are the most common asthma trigger that we see in our clinic. Let's go to the next slide. Infection. Usually when the child gets sick with a cold or a flu or COVID-19, sometimes the asthma can exacerbate, meaning can be affected, and they're having to fight the cold, the infection, and asthma at the same time. So that's one of the trigger, most common trigger in younger kids, especially in, like infant, toddler, preschool, and school-age kids. Another one that gets a lot is that are allergies related, whether it's outdoor or indoor allergens. Exercise, physical activity, those are usually for the older kids. We don't see a lot of those for the young kids. Nighttime, what that means is when the kids is in, you know, sleeping in their bedroom environment, maybe the room is too cold, or maybe there's carpet in their bedroom, or they're sleeping with a lot of stuffed animals, or maybe a pet, or it could be positional, meaning they may be sleeping flat on their back, and that's not helping them. They may have to either turn a little side, or maybe a little bit propped up. That will help them also to avoid some of that trigger. Smoking, not necessarily the kid, but what the tobacco smoke, wildfire, or any kind of maybe a fireplace. Those can also affect somebody who may be sensitive to that. Weather, what it means is a change of temperature, maybe going from cold to warm or warm to cold, or maybe it's windy, raining, snowing. Also stress. I know not many kids, you think they don't have stress, but they do in their own way, and that can also trigger their asthma. Or if a kid get too emotional, like, you know, they cry too much or laugh too hard, that can also trigger asthma. Things that may be around your house, mold or mildew that you see around, that can definitely pose a great concern. Some kids are sensitive to strong smells or odor, like cleaning solution, perfumes, colognes, maybe something very fragrant in your cooking that can also have an effect. Of course, the allergens, outdoor allergens like pollen, weeds, trees, grass, that can also have an effect. Dust mites that can also be found in furniture, sofa, in your bed or in the child's bed, carpet, also dusty. If you have carpet in the home, that can also create problem um, for children with asthma. And pets, cats, and basically any animals with fur, like dogs or rabbit, guinea pigs. And this is not really a whole list of it. There may be other allergens out there or triggers that may cause, but these are the one that we see quite often.
Okay, so types of asthma medications. Okay. And of course, we have two questions here. So, Leah? So question in this part is, quick relief medicine helps you feel better faster by relaxing muscles which are tightening around the airway. True or false? Okay, great. So that is true. So yes, it does help relax the muscles which are tightening around the airway. So thank you. So let's do the next polling question. So the next question is, controller medicines are taken daily to prevent an asthma attack by decreasing swelling and mucus in the airway. True or false? Okay, so we're going to share results. Yes, so it is true. Controller medicine help you by decreasing swelling and mucus around the airway. So let's talk more about these asthma medications that are commonly used. Okay, so next slide here. Okay, so what is a quick reliever and also controller medication? We use the word quick reliever or rescue medication interchangeably, right? Because it's what we've been using. The quick reliever helps during an asthma episode. You should have one available when symptoms occur, right? And you should have it available at all times, even at school. So you don't want to leave your home or place, or you want to make sure you have a quick reliever or rescue medication all the time. A controller medicine helps prevent an asthma episode, right? You need to take it every day to make sure your airways are less sensitive, right? And also it helps you have fewer symptoms over time. So that's controller medication. So controller medication are steroids, and the quick reliever medications are bronchodilators. And we'll talk about a little bit more about that too in the next couple of slides. So how does it work? How does a quick reliever or rescue medication versus a controller medication work? So the quick reliever helps relieve the tightening around the muscle, around the airways, right? So if you see this normal airway, you see that the air comes in and out, is wide and open, right? When kids are very sick, but you have constant cough and they need something better to control their symptoms, and that's when we prescribe the controller medication. Controller medication helps prevent and control swelling in the extra mucus around the airways, right? So if you see this asthma airway, you see the yellow color here, the mucus is there, it's plugging up the airway, there's tightening around the muscles, and there's air just trapped around your air sac, which makes it very difficult to breathe. When do I use a quick reliever medication versus a controller medication? Well, you use your quick reliever when you have symptoms, right? It helps decrease the symptoms, usually, anything from 5 to 10, even 20 minutes, depending how severe symptoms could be. And we use it, and we recommend it to use it 15 minutes before your exercise, if exercise is a trigger for your asthma or asthma symptoms like a cough. So we ask you for the child to take it 15-20 minutes before they play, and that helps a lot. Controller medications, you take that every day. It works slowly over time, and if you stop, the symptoms may come back right away. So it's good to take it every day and talk to your provider before stopping it or your medication at all. If we look at this chart, it's overwhelming. These are all the asthma medications that are prescribed for kids and adults. If you see the top right one, we have the quick relief medication with a short acting beta-2 medication, which are called the bronchodilators, right? It helps open your airways, right? We have this brown section, we have inhaled corticosteroid, which are your controlled medication. These are just one type of medication, which it could be Flovin, it could be Advair, Pulmicort. And if you look at the controlled medication at the bottom, the combined medications, those are ones that have like 2 medicines in one. It has a bronchodilator and also a steroid combination. And those are medications that we tend to prescribe with kids who have moderate to severe symptoms. Just to be briefly, there's 4 classifications of asthma, and within each classification we have a sub-classification too, but we have your mild intermittent asthma, you have your mild persistent asthma, you have your moderate persistent asthma, and then you have your severe persistent asthma. So usually your combined medications, but we kind of prescribe kids who are moderate and severe. Just more in detail, you can see the medications, and these are the medicines that mostly insurance will cover, right? So if kids have, Medi-Cal, Alliance, Blue Cross, these are the ones that are going to be covered. So for your quick reliever rescue medications, they have different names: Air, Proventil, Ventolin, Suplenex, and then for your controller or steroid medication, you have your Flovin, Qvar, Dulera, Advair. Singular it has a different classification. Your tablets, they come in chewable as well, or tablets that you could swallow, and these work for patients especially for allergies. When you have allergy and asthma combination, it really helps control your symptoms. The bottom here are once again your combined medication that we tend to prescribe for kids who have moderate to severe asthma. The most common ones are your Advair disc, your Advair inhaler. You have your Dulera too as well that are commonly prescribed to, Bachelor too as well. One thing I want to emphasize that it's so hard to say, and for parents to remember the names, right? They say, oh, it's the orange one, or it's the blue one that I take, right? So important for them to know the name or bring in the medication, because these colors change. And when you say I'm taking the orange one, I'm thinking like, oh my God, which orange one is that? So, or even now it's so easy, you can just take a picture of it and then bring it in. You don't have to bring a medication, take a picture of your medication and bring it in. It makes it a lot easier to decide which medication you're taking or not. Robert, anything that you want to add about medications?
Yeah, I just want to emphasize for parents, caregiver, that color is not necessarily the best way to identify medication. And a lot of this medication, as you see, like the Air, Ventolin, Flovin, Qvar, those are the brand name. Also, in addition to knowing the brand name, most of this medication may be available in a generic form. Like for the rescue medication, the generic name for basically all those rescue medication will be the albuterol. So as long as you know albuterol, regardless of the brand, you will be getting the rescue medication. The same thing with some of this controller medication that contain the inhaled corticosteroid. They have different type of corticosteroids, so their generic name might be a little bit different from each of these brands. So like Flovin, they may call it fluticasone. Qvar, they may call it methylmecos, something like that. I forget. But anyways, at least either remember the brand name or the generic name, and of course the strength of the medication. So, and don't just rely on color. Okay, back to you, Lourdes.
Yes, great. In our clinic, we have a picture of these medications because it's helpful, sometimes by seeing it and they look at it, say, okay, this is the medicine I have. So maybe that's, charts, pictures, say a lot. So We have that, and maybe that's something that maybe you could probably have say, okay, did you bring your rescue medication, your control medication for your child? You know, what is it? What does it look like? You know, so show that picture. It's very helpful. Okay, great. So we wanted to have a quick check-in to see if anybody have any questions, you know, right now. Please feel free and writing something in the chat, typing there, anything that we've talked, anything that wasn't clear for you, please write in some questions. I know in the beginning when we talked about, I talked about the national stats on 0 to 4 years old, who, you know, who have the highest, actually now in Alameda County, who have the highest ER visits among this specific age group. Why do you think this happens? Why is it that we're seeing more young kids, 0 to 4, going to the ER more often? Robert, do you want to answer that one?
Yes. Part of the reason why that data is kind of higher than the other age group is due to that, you know, most likely that's when parents find out that their child gets diagnosed with asthma. They have the first asthma attack. They have no idea what's going on. All they see that the child is coughing a lot and they're having difficulty breathing. So they go to the ER. Then then the doctor, nurses over there, they look at the child, they do the exam, they listen to the lungs, and then they start, hey, your child has been wheezing. How long has it been coughing? And usually, you know, we normally hear the same story that, yes, child's been coughing for the last 2 or 3 days. And then this gets worse at nighttime, and then eventually they end up in the ER. So then they start going about history of the family, whether they have asthma, and not necessarily just because there's no history of asthma in the family doesn't mean that the child won't have asthma, because asthma can be hereditary, you know, passed on from one generation to another generation. It can also skip a generation or two, and also can be caused by environmental triggers and other type of triggers if they get exposed for a while or long term.
I also wanted to just add that during this time of 0 to 4, you know, they're exposed to a lot of viruses, you know, sickness. That's when everything kind of just blossoms, right? And, you know, you think it's a cold, and it's a cough, and kids are coughing even though they don't have a cold, you know, that'll be concerning. You know, the cough that lasts more than 2 weeks or more than, you know, a month or several months, then you really need to bring the child in to get more of a thorough history about what's going on with your child's asthma. In particularly, like Robert mentioned, if there's a family history of asthma and one of the parents, a sibling, that just raises up the more the concern that the child could have asthma, or if there's any history of hospitalization as an infant with bronchiolitis or RSV, you know, that just kind of, you know, it's another indication that it could be leading more towards an asthma diagnosis. Okay.
Hello, can anybody hear me?
Yes, we could.
Hi, everybody. My name is Alejandra. I'm a public health nurse with Alameda County. And I just was inquiring about a question about what your take is in regards of continuing with masking. I know at the community clinic where I was at before, it was strictly like internal med. So I just focused more on adults, and now it's like more like kiddos. And I have found that obviously working with adults, even though we are all mask fatigued, due to the pandemic, that there was some truth about them continuing to wear the mask and how it helped with asthma exacerbations. And I feel like the truth goes also for children in regards of like, you know, less allergens that go into like the mouth and the nose. I know I try to be really diligent about educating my families and obviously their children about that, but it's kind of a tough line depending on like their age and if, you know, they're already so tired of wearing the mask. And I was just wondering what your take was on that. Thanks so much.
No problem. What a great question. We have a lot of information, and we're just, we talk about this in our clinic constantly because we saw a major decrease in symptoms in our asthma patients, especially the ones that had the more moderate to severe diagnosis. So much that when we were all wearing their masks and we were all, socially isolated, we saw a decrease in even using their controller medication. From severe, someone went down to severe to moderate, and someone from moderate to persistent, and someone went from moderate to intermittent, So yes, you're right. The masks help us not spread our germs. The constant washing our hands, which is very basic and easy, but what we saw truth for that, right? Washing your hands make a difference, right? We also saw in kids when they go to school, because that's where they're exposed to a lot of allergens and triggers, right? The dust, the grass, playing outside, we saw also that the symptoms were less, right? And we also saw, at least for adults and the older kids wearing the mask, we saw the younger kids were not getting sick that much too, as well, because they were not bringing, the germs that to the household as much, because it was less of a sharing, right? At this point, things have changed a little bit, but we don't want to be so, thinking that everything's okay. I would say take precaution, where we go, where you do, yes, it's summer, but then, you still hear things and popping up here and there in terms of COVID, right? And then we have just the spring and summer just viruses that happen, right? So unfortunately, when you're a daycare, that's where it's a good area to kind of spread, and it's hard for little ones to kind of wear the mask. But I would recommend, depending, the time of the season, for the daycare personnel to wear their mask, right? Use common sense, see what's happening, because it does help decrease the spreading of disease in either daycare or school or whether at home. Yeah. Hey, Robert, anything you would like to add?
Yes. So the data that you saw was prior. That's from 2019. I believe it was 2019. So when we had our the lockdown, the pandemic lockdown from 2020, 2021, or ER, did not see. I think we had like a drop of asthma, probably close to like 80% drop in kids coming in with asthma. So basically the ER was practically empty. Hospitalization was very minimal for asthma. We have a resident program that we talk. I mean, we mentor, we teach resident, and there were not many patients coming into our asthma clinic either. So part of that, to answer your question, yes, masking does work, but is it acceptable for society? I mean, that's something that each individual will have to consider. I know some family continue to mask, and probably most of them are not masking anymore. So it's just, I guess it's up to the individual to do that. But yes, masking does prevent spread of illnesses, viruses, diseases, and all of that.
Okay. If you have any other questions along the way, please put them in the chat. We'll try to answer too as well. Thank you. Okay, asthma devices.
All right. Let's go to the next slide. So now that the doctor has your medication, prescribe your medication, now the thing is, how do I use this medication? But before we go through that, let's go ahead and do this polling question. So who needs a spacer with their inhaler? No one. They can just take the medication without a spacer. Children under 12, adults only, or everyone? Okay. Let's go ahead and end the poll and show the result. interesting. Well, we got a 50-50 split. That children under 12 should be using spacer and everyone should be using spacer. So what is our correct answer, Lourdes?
D, everyone.
Yes,
Everyone.
everyone needs to be using a spacer. One of my pet peeves, you know, when you're watching TV or you're in a movie and you see, you know, somebody using an inhaler and then they just put it straight in their mouth. I go, don't do that. You need a spacer with that. You're doing it wrong. That's just one of my pet peeves. But anyway, what are spacers? So the technical name that I think most of our healthcare workers will use are valve holding chamber. But I call it spacer just because it's easy for everybody it's easy for them to remember, easy for me to remember. And then of course, it sort of sounds good with this, the spacer. And what it does, the spacer, it allows the medication to basically stay inside the spacer. So that way, when you use the inhaler, when you do the spray, usually the spray comes out very quick. And if that happens, what is going to end up, let me go to the next slide and I'll show you that if you see the poster where it says inhaler alone, when you're using an inhaler without the spacer and then you do the spray, usually the spray ends up in the back of your mouth and in your throat, and then of course then you end up swallowing that medication and goes in your tummy, and then where your lungs are, you don't get a lot of medication. So if you give it to a 5-year-old child medication without the spacer, chances are they're not going to get more than 20% of that medication. And if you use one of the spacer, and as you can see, we have different type of spacer. One has a mask, and the orange one with the mask usually is for infant and possibly toddler, and then the yellow one with the mask is used for the older kids, maybe like school-age kids. And then for older kids, the blue one, that's the one that without the mask, that goes straight in their mouth. So, and then I'll have some video that will show you how each of those are used. But anyways, going back to this poster, when you use a spacer, you see like practically all the medication do end up in the lung. And that's where we want that medication to be, in the lung, not in your throat, not in your mouth, or not in your tummy. So
hey, Robert,
yes.
Maria has a question in the chat. It says, do adults with asthma need to use the spacer too?
Yes. So going back to the polling question, everybody who has asthma, everybody who uses an inhaler should be using a spacer. Adults will most likely need to use something like this blue one, the one without the mask. And then, and what it does, even an adult who's pretty well coordinated, they, if they use it without a spacer, they may get maybe 50% of the medication, but they're never going to be compared to getting practically all the medication by using a spacer. Okay. This is a video of a...
Robert, let me make a comment just to say
yes.
that it's a very different when you do if you have asthma, right? Try using spacer and then using without a spacer. You'll notice the difference right away. First of all, your symptoms are going to get better, right? And the second of all, you're going to feel like a taste of the medicine versus not using an inhaler, right? You know, and I know sometimes it's hard to, as adults, or you have your spouses, your family who don't want to use a spacer, right? You know, hey, it's happened to me. Family members don't want to use, but you know, I think it's really important. You want to get better, you need to use your spacer, right? Because that's, you're not going to get better quicker. So, you know, looking at the back again in the national stats where adults have more your visits also, and also have hospitalization, you ask like all these adults are not probably using their spacer, and therefore getting sicker quicker and going to the hospital or ER. Yeah. So thank you for that question.
Also, one thing that I teach family is if parents have asthma, and I ask them, do you have a spacer? If they don't have a spacer, we try to provide them with a spacer, or we have them to go to the doctor and have them to get a spacer prescribed to them. And then definitely we show them how to use it as well, because I mean, as parents, you want to lead by example for your child or children. If they see you using a spacer, most likely they're going to use a spacer. So the last thing you want to hear is that, hey, mom or dad, don't use a spacer, so I just going to do it the way they do it. Okay, let's go ahead and play this video. Okay.
How to use a meter-dose inhaler with a valved holding chamber and mask, also sometimes referred to as a spacer. Check the dose counter on the inhaler. Do not use it if it says 0. 0 means the inhaler is empty and needs to be replaced. Prime a brand new inhaler before using it for the first time. This prepares the inhaler for use. Prime the inhaler by shaking the inhaler for 10 seconds and spraying 2 or 4 puffs into the air based on your medicine instructions. Prime again if you have not used this inhaler for 1 to 2 weeks or have dropped it. Priming does not waste doses. To take a dose, shake the inhaler to mix the medicine. Take the cap off the inhaler. Make sure the mouthpiece and valve holding chamber are clean and there is nothing inside the mouthpiece. Place the inhaler mouthpiece into the open end of the valve holding chamber. Place the mask onto the mouthpiece of the chamber. Some chambers may already have the mask attached. Prepare your body by sitting or standing up straight. Place the mask over the individual's nose and mouth, making a tight seal. Hold the inhaler with your pointer finger on the top of the inhaler and thumb on the bottom. Press down on the inhaler once to release the medicine. Hold mask on individual's face while they take 6 regular breaths or for about 10 seconds. If the holding chamber whistles, you are breathing in too fast. Repeat these steps in 1 minute if using more than 1 puff. Rinse your mouth with water and spit it out. Once finished, wipe your face with a damp cloth. Store in a cool, dry place. Clean your inhaler, chamber or spacer with mask according to their package instructions. If you have trouble using the inhaler correctly, ask your pharmacist or doctor for help.
Okay. All right.
Hey, Robert, we have another question in the chat.
Yes.
Oh, looks like.
Yeah, I see. Yes. That's correct. We call it espaciador. So our next video is the mask. It's using the inhaler with the mouthpiece. Let's go ahead.
Using asthma medications properly can be difficult, but good technique is critical to good asthma control. Older kids who can hold their breath for at least 10 seconds can use an inhaler or MDI with a spacer and a mouthpiece. Every time you use your inhaler, you should use a spacer. 1.
Remove the cap off the mouthpieces of the inhaler and spacer device.
2.
Shake the inhaler for at least 5 seconds before use.
3.
If your inhaler is new, or if you've not used it in the past 2 weeks, or you have dropped it on the floor, you will need to spray the inhaler 3 to 4 times to get the inhaler ready to deliver the medication. Check the package insert or check with your doctor for details about your inhaler.
4.
Fit the inhaler into the spacer.
5.
Breathe out slowly and completely away from your spacer to empty your lungs.
6.
Place spacer into your mouth and close your lips tightly around the mouthpiece. Make sure your tongue and teeth are not blocking the opening.
7.
Press down on the inhaler firmly to release the medication.
8.
Breathe in slowly. Keep breathing in slowly until you have taken a full breath. You should not be able to see any mist escape from your mouth or nose.
9.
Remove the spacer from your mouth. Hold your breath for 10 seconds, if possible. Allow the medication to go deeply into your lungs, then breathe out.
10.
Wait 1 minute before taking the next puff of medication.
After you've used your MDI and spacer, rinse out your mouth with water to help reduce unwanted side effects, such as thrush, sore throat, and hoarse voice. Do not swallow the water. Keep track of how many puffs you have used and when you are due for a refill, because it is not possible to tell if the inhaler is empty just by shaking or spraying it. Common mistakes are not shaking the canister each time, not breathing out completely before using your inhaler, not holding your breath for 10 seconds after breathing in the medicine, not waiting 1 minute before repeating a puff, not priming your inhaler, not knowing when your inhaler is empty. Ask your doctor to show you again if you still have questions about how to use your inhaler and spacer. Remember, even big kids still need reminders to take their medicine and supervision to make sure they are using proper technique. It is important to clean your inhaler and spacer. The inhaler mouthpiece should be washed at least once a week to prevent medication buildup and blockage. To clean it, remove the metal canister and cap from mouthpiece. Set the canister and cap aside. Never wash or immerse canister in water. Wash mouthpiece under warm running water for 30 seconds. Shake off excess water and allow it to air dry overnight. To clean your spacer, take it apart. Wash all the parts in clean, warm, soapy water. Allow the pieces to air dry. Reassemble the pieces when dry.
Okay, let's go to the next slide. So this one, so in addition to the inhalers, we have medication that are given via a nebulizer. And what that nebulizer does is basically turn a liquid medication into some sort of mist. So that way it can be inhaled. It does take a little longer to administer the medication. May take around 10 to 15 minutes to do a treatment compared to taking 2 puffs of your inhaler. But it is also another way, and it's also an effective way of administering the medication. So let's go ahead and watch the video first, and then we can do a little discussion afterwards.
Using asthma medications properly can be difficult, but good technique is critical to good asthma control. 1.
Always start with a clean nebulizer cup. Fill the nebulizer cup with the prescribed amount of medications.
2.
If you were instructed to use the mask, attach mask directly to the nebulizer cup.
3.
Connect tubing from the compressor to the bottom of the nebulizer cup.
4.
Turn on air compressor.
5.
If you are giving the treatment to a small child, place the mask over your child's nose and mouth so that the mask touches the skin directly. If you are giving the treatment to an older child, you can use the mouthpiece or place mask over mouth and nose. Breathe in the mist slowly and then breathe out slowly. Do not use blow-by technique. If the mouthpiece or mask is held away from the face, the medication will be lost and you will not get the full benefit of the medicine.
6.
Continue until medication is gone or you hear a sputtering sound.
7.
Turn off air compressor.
8.
Disconnect tubing from bottom of cup.
It is important to clean your nebulizer regularly. Please follow the detailed specific instructions from the manufacturer of your nebulizer kit. After you've used your nebulizer, rinse out your mouth with water to help reduce unwanted side effects: oral thrush, sore throat, and hoarse voice. Do not swallow the water. For infants and toddlers using a mask, wipe the child's face and mouth with a wet towel after use. In general, You should rinse the nebulizer cup and mask after each treatment and disinfect the nebulizer cup weekly. After each treatment, rinse the nebulizer cup and mask with hot tap water. At the end of each day, wash the cup and mask in hot soapy water. Rinse well. Allow to air dry. Do not wash the tubing. If the tubing gets wet on the inside, get new tubing. You should disinfect the nebulizer at least once a week. There are several choices for disinfecting the nebulizer cup. 1. Wash in a dishwasher if the water temperature gets above 158 degrees for greater than 30 minutes. 2. Boil in water for 5 minutes. 3. Soak in 70% isopropyl alcohol for 5 minutes and rinse with sterile water. Or 4. Soak in 3% hydrogen peroxide for 30 minutes and rinse with sterile water. Check the manufacturer's instructions for care and cleaning of the compressor. In particular, look to see how often the filter needs to be changed.
All right. Anybody has any questions or comments about how to use the spacers and nebulizer? Okay.
Robert, can you show us? I don't know if you have your spacer with you to see how it detach.
Yes, I'm about to do that on our next the next 2 slides.
Okay, perfect.
Yes, but our next slide, Leah, I'm not able to advance to the next slide, but can you do that for me? Thank you. And then we have a polling question. And this is a question that we get asked in our clinic quite often. Which is better, inhaler with a spacer or nebulizer? Go ahead and let's bring the question. So true or false, inhalers and spacers work just as well as a nebulizer machine to give asthma medication. Okay, let's share the results. So what's the correct answer, Lourdes?
The correct answer is true.
So
if used appropriately, your inhaler and spacers work just as well as a nebulizer machine. Of course, there's a lot of variables on this. It just depends on the severity of the child who's having symptoms right at the moment, and also the age of the child too. But if you use appropriately and the child could use it, it works just as well as a nebulizer.
yes, and that, yeah, I mean, the key point to that is that using it correctly. If you use your inhaler with a spacer correctly, you will get the same. I mean, first of all, you're giving the same medication just in different manners or different ways. As long as you're using it correctly, you will get the medication will get there in the lung, and that will work as well as a nebulizer. And we understand that if you ever seen, if you have a child or know of a child that's been to the ER for asthma, one thing that you're going to notice, they're going to put them on a nebulizer treatment. But the reason they do that at the ER, it's not just because it works better, it's just because they can always keep adding medication, and they're also giving much more medication than what you would give at home. So and then they're putting a lot more than just one medication in that nebulizer treatment. And that nebulizer treatment can go on for hours, not necessarily for just one treatment, which is around 10 to 15 minutes. So I mean, of course, they definitely want the child to get better in the shortest amount of time. That's what they do at the ER. So now that you know how to use a spacer, how do you clean it? So I don't know if you can see, I have one of the spacer here. Obviously, if you're using medication on a daily basis, you will want to clean your spacer at least once a week. More often if you feel it's necessary, but definitely once a week is fine. And if you do that, the maintenance, the cleaning once a week, your spacer will last a long time, even more than a year. Actually, there was one patient who brought his spacer, and and they had it for like 3 years, and it looked pretty much brand new. So because they were doing great maintenance, but most of the time, we do recommend replacing a spacer at least once a year, just because I mean, the insurance do cover a spacer, and they do cover one spacer a year. So at least most insurance that we know of. But anyways, so before you start cleaning up, you can always disassemble the spacer, as like, you know, the mask part can come off, the back part where the inhaler goes, that could come off. And if any other parts does not come off, you don't have to force it, okay? It should come off easily. And get a basin or container with warm soapy water and just leave it there, soaking for around 10, 15 minutes. Shake it, agitate it every now and then. Do not scrub the spacer, especially the inside part of it. I know it looks a little hazy or cloudy, but that's the way it is. It does have a coating. Basically, it's an anti-static coating to keep the medication from sticking inside. And then after the soaking, you just have to rinse it with warm water, all the parts, and just let it air dry and reassemble prior to the next time you need to use it. And you would do this, the same thing with the mouth spacer. Whatever comes off, you pop it open and just do that. And go through the same process of cleaning your spacer.
Great. Any questions? Please feel free to unmute. Please ask any questions, or in the chat too as well.
Yes. Some spacers do have expiration date on the box. That's correct. That's on the chat. The thing is that the spacer has lots of rubber parts that over time, those rubber part can decay or brittle. So you may just want to consider at least, you know, once a year replacing it. Now, also, some of our family have asked that about cleaning solution because they may clean with pine sol, bleach, and even those cleaning solutions are very good at cleaning, they do have lots of, you know, smell or fumes, and that can also pose a problem for our kids with asthma. It can trigger the asthma. So this you can find this in your handouts. And most of these cleaning solutions are just basically made with either baking soda, vinegar, and they're basically asthma friendly. And we have something like all-purpose cleaner, window cleaner, bathroom toilet cleaner, mold cleaner, drain cleaner, oven cleaner, and furniture cleaner as well. Asthma action plan. So before we start on that topic, we have another question, polling question. You want to give a little introduction on this question, Lourdes?
You know, I guess we'll just do the question first, and then we'll talk a little bit more about it. Okay, if your child's asthma is well controlled, you can exercise and play sports without coughing, wheezing, or chest tightness. True or false? Yes, true. So great. All of you got it right. Thank you very much. Robert, there's a question right now in the chat. Okay. We were told that the integrity of the materials can change, especially if it's watched frequently. Robert, I think you're mute.
Okay. Thank you. That it is true that too much washing can affect the anti-static coating of the spacer. number one, of course, I mentioned, please do not do any type of scrubbing, especially the inside of it. Another thing that in order to maintain that anti-static coating, what you can do is when you wash it in that soapy water, do not rinse it. Just let it air dry. And that way, what happens, I think the soap, part of the soapy water, when it dries, it keeps the integrity of that coating intact, or at least it won't affect it as much. So you can also do that. I mean, if you do that once a week, cleaning, and get your spacer replaced once a year, you should be fine.
And also, it all depends how the frequency that you're using it, right? You're gonna need to wash it once a week, and if you're not using it that much, then it's gonna last you for a long time as well.
Okay, asthma action plan. So what is an asthma action plan? When you take your child to the doctor for their, let's just say, asthma checkup, follow-up, or if it's a recently diagnosed asthma, after the visit, your doctor will already talk to you about the medication that your child should be taking, and how to take those medication and when to take it. And then your doctor will also say, hey, we also have this asthma action plan, like if you forget when to give or how to give it or when to use it, that's what that asthma action plan. This is just one of the several examples. This one is, I do like this one because it's a fairly simple and very visual compared to this other one that from this slide, but either one is fine. This asthma action plan are usually used for yourself and also to give copy of this plan to the school, daycare, preschool, or anybody who keeps an eye on your child when you're not around. And basically, it's divided into 3 sections. It's color, green, yellow, and red. And basically, the green section is if your child is doing well, basically don't have any symptom, and on the daily basis, they just gonna take their medication. And usually the doctor will write the information, what medications to take in the morning and at nighttime, if it's applicable. And this is hopefully should be the normal thing, the green zone. Now, of course, as you know, kids do get sick from time to time, and they may start coughing. They may have some difficulty breathing. They may start wheezing. They may say, Mom, Dad, I did my medication. So, and this is when they start having symptoms. Your doctor will write the information. Will probably usually say, use your rescue medication, or in this case, the albuterol, and the number of puff. And the most common one, it will be 2 puff with spacer every 4 hours as needed until symptoms go away. Sometimes in the yellow zone, if it continues, and this is more like that information is probably more available on this one, on the yellow zone. But your doctor may say that if the symptoms do not resolve after the first 2 puff of albuterol, you can give it again in another 20 minutes. And then after 20 minutes later, the symptoms do not resolve. They give it another 2 puff again, 20 minutes later. Basically, you probably gave 6 puff total in that 20 minutes, which is 60 minutes. And if it continues, then at that time, you should be looking at going to the next step, which is the red zone. And under the red zone, that this is where, when you watched the video earlier, if the child is having difficulty breathing, they cannot stop coughing, they have those retraction, They have the nasal flaring, or if they're trying to say something to you and they have to take a breath between 1 or 2 words, this is the point where you need to start seeking medical attention. Either you take them to the ER or may end up calling the paramedics. And this is where you start giving, anywhere from whatever the doctor may write down. Over here is written as 6 to 8 puff. Normally, we'll probably say 2 to 4 puff every 15, 20 minutes until either you get to the ER or medical attentions get to you. So this is something that you will follow with this asthma action plan. Go ahead.
One thing I just want to add, that this is an individual asthma action plan. So not everybody is going to follow what the action plan has, right? So everybody's different. So that's a conversation that you need to have with your provider about how many puffs you're going to be able to give to your child during the yellow zone or during the red zone. Because once again, remember I said there's like 4 different levels of asthma severity: mild, intermittent, mild persistent, moderate asthma, and severe asthma. So it's very different in those categories and very individualized as well.
And some of this asthma action plan, like this particular one, is a more detail. It will list all the medication that they're taking. So that way they know, like the daycare provider, the school know what other medication you are taking in case the child needs to go to the ER. So at least they can take this information and provide that to the ER nurses and doctors over there. And also this particular asthma action plan, near the bottom, it will also state whether the child can self-medicate and can carry their medication. Usually most of the younger children, probably from 0 to 5, they may not need to carry their own medication or self-medicate. They'll probably need, highly likely need assistance from one of the staff to give the medication as indicated in the asthma action plan. In addition, and also asthma action plans should be updated at least once a year. More often if you have some sort of persistent asthma, like if you're like more in the moderate to severe, maybe at least twice a year, or anytime there's a medication change, the asthma action plan needs to be updated as well. In addition to this asthma action plan, if you are providing medication to the school and daycare, you may need a form signed by your doctor for the prescribed medication. And Lourdes will fill you in on that.
So before I talk about authorization for medication, just wanted to emphasize for the asthma action plan, right? It's very individualized, and also depending, like Robert said, changes to your medication, we need to update that one, and then your school or daycare should have the latest form too as well. So if somebody is more in the moderate to severe or even persistent, it just depends. Once again, the triggers, the season. Sometimes we do changes every 3 months, and that action plan will change. So just making sure you have the latest copy at home, as well as the areas where your kid attends school or daycare. So along with prescribing medication, schools also, or daycares, we fill out this form a lot, authorization for medicine. So this is a form that us as providers fill out for a bureau, how many times they get to use the medication at daycare or at school. So really important. This is a sample of the Oakland Unified School District authorization for medication. It's available online. If you don't have it available, you can bring it. We also have a standard authorization form in our clinic to also provide, and that also works very well for schools and other institutions. The next one is, let me see what event. Okay. Nope, it's not advancing.
Okay, let me see.
Maybe. Well, the next slide, see, Robert, you could advance it. The next slide is another authorization for medication, just another example for the San Leandro School, Unified School District that I have.
Oh, we may have to ask Leah to advance to the next slide. Okay.
Sorry about that. We're having some difficulties here, but anyways, any questions about the asthma action plan or the authorization for medicine? We do have them available for you in the materials that we're sharing with you. Let me see. Oh, we'll see.
Nope.
Leah. Going just blank on there. Okay, well, maybe we'll do the next question because this is next section that we're talking about advocacy, right? And this will be our last question that we have. And what I'll do is I'll copy this one. I'll put it in the chat. Okay. So this is a question. It's in the chat. Regular asthma checkups can help get and keep your child's asthma under good control. What would you say, true or false? And please feel free to answer that. It's our last question, and thank you for answering all the questions for us.
Okay.
So the question in the chat is, regular asthma checkups can help get and keep your child's asthma under good control. True or false? Okay. So yes, this is true. So regular asthma checkups does help your asthma get under good control. So great, thank you for answering that. Okay. So what questions to ask as parent or caregiver? What to ask to your doctor when you go see them, right? Bring all the forms necessary. Bring your medication forms either from school or for daycare. Bring all your asthma medication and including your spacer, right? If not, at least take a picture so we could have an idea of what medication you're taking and kind of help decrease the confusion or the questions. Let's ask about medication side effects. What are the common side effects for albuterol? How about for the steroids that my child is taking? For albuterol, we see kids tend to get very hyper jittery, jumping up and down after albuterol, but then that's just for a brief couple minutes, and then it changes. And the most important thing that it helps open up their airways, which we want them to breathe, right? The whole getting hyper and everything tends to go away. There are some kids that they respond very negatively to albuterol and just gets them too hyper. And rarely do we need to prescribe like another medication like Sopanex, which is something that it helps kind of decrease the jitteriness and the hyperactivity in kids. We, like the videos mentioned, the use of steroids within time, could create like a white kind of coating on your tongue, which you call a thrush, right? So making sure you drink water after that or rinsing is really important. Ask questions about which one do I give every day? Like, which medication do I give every day? And also ask for your asthma action plan. It's not only good for school to have, but also for you to have and put it on your refrigerator somewhere visible as well. Ask for plenty of refills. You don't want to run out on a 3-day weekend or you're on vacation, right? You want to prepare yourself when you're traveling, right? Get all your medication because, the worst thing is being away from home, away from your doctors, and then you don't have enough refills with you. So please remember to ask all these questions and be prepared.
Okay, so what are questions that you should be asking as parents to your daycare school? What forms do I need to provide you for, for you to be able to give medication to my child? And this is the form that needs to be signed and of course filled out and signed by your doctor. You may also need to provide them with the asthma action plan so that way they have an idea or need to know what to do in case that your child is having some asthma symptoms. Another question is, where are the asthma medication kept over there, the day school or at the daycare or school? Is it kept at the main office? Is it kept in a locked area? Is it kept in the classroom? And that way, always ask those questions. And who is going to give the medication to your child? Is it the teacher? Is it the office staff? Is there a nurse on site? Probably not with nowadays, a lot of this budget cut. And then what is their emergency medical plan? Meaning, if your child is having let's say a severe asthma attack, what is the protocol? Do they call 911? Do they call you first before 911? So these are the kind of questions you would want to ask your daycare or school. And that way you know that they're prepared for any type of medical situation that can happen with your child. Okay, Lourdes, is that
Yes.
your
So
slide?
parent,
Okay.
yeah. So the parent role is very important to make sure you learn your medication name, right? Know which is your fast acting, which is your controller, right? Medication, because it's really important to know the names because if we try to revise and make changes, we want to know what all their medications they're taking. Learning about your child's illness and disease, right? It's very important, and thank you for everyone who is here, because you're bringing that information to your families and to the people you provide service to. Ask many questions, right? Ask for resources that are reliable. Not everything that you see online is true, so making sure that you get resources that are reliable and dependable. Like I mentioned, don't run out of your medications. Be on top of it. Make sure you have enough refills. And making sure that you see your pediatrician or your child's doctor routinely. And like we mentioned that their asthma action plan needs to be revised at least once a year, and then more often depending if there's any changes in the asthma medication. Robert, you want to add anything?
No, let's go.
Yeah.
So
the common misconceptions, right? Yeah. I'll go do this one. So for this, we want to make sure that families say they're using their inhaler without spacer, right? Which is not true. We want to make sure you use your inhaler with a spacer at all time, right? Families think that we see so many times families switching their rescue medication for the controller. It doesn't matter how many years they've had asthma, if they're new or a patient that's been diagnosed for a while, we still see that they switch their controller for rescue medication and rescue medication for controller as well. That's what's so important, to know the names or at least take a picture of your medications to know which one they're taking. Families are concerned if they could get addicted to the medication. That's why they don't give the medication. No, they're not going to get addicted to the medication, right? What's going to happen if they're not taking the medicine, they're going to get sick and end up going to the emergency, being hospitalized. Families say, I have no symptoms, therefore I stop using my inhaler or medicines, right? Or they stop giving it to their child if they didn't have symptoms. That's great. That's our goal, is to make sure they don't have symptoms. But we want to continue giving the medication because that's a go, but not to stop the medication completely. And there's a time, because like I mentioned, asthma is a disease of variability that it changes depending on triggers, weather, that after maybe taking the medication for like maybe 3 consecutive months and the child hasn't had any symptoms, and that's when we can say, okay, let's talk about reducing their medicine. But we reduce it slowly and making sure that the child is stable and have quick check-ins to make sure. And then many times we might stop it, and then we might bring it back. Steroids are not good to take because they make me big, they make me grow more, gain weight. This is not the type of steroid that's going to do that. This is a steroid that's going to go directly to the lungs where it's mostly you need it, right? It's anything that inhales going to go to the lungs. Very minimal goes to your bloodstream, but does not cause any of those side effects that we hear. The ones that get a little bit more concerning, and those are the steroids that you take, like the oral little pills, the steroids that are taken orally. Those, you see the effects on those when patients are giving that like for a couple months, then you might see some side effects. But for the inhaled steroids, we haven't seen this at all. Families are resistant in taking medication because of all what I mentioned before. And sometimes it's hard to talk to families about taking medicine, and it's hard to see your child sick, and it's hard to sometimes feel that you need to take the medicine, that your child will depend on it all the time. But I see that asthma is one of those diagnoses that you have a lot of medication, you have a lot of options, and working with families to see how you can meet their ends is pretty important, right? Because we are constantly making that adjustment and listening to our families. Because the ultimate goal is to make sure the child is away from ER and especially away from being hospitalized. And the other common misconception that we get is, does asthma go away? Well, we like to say that asthma goes to sleep. It stays dormant, for some time. Some kids, families say, oh, they tend to go out of it, right? Well, I wouldn't hold my breath on that one, because sometimes asthma could come back later on in life, depending on if you're in a different situation. Maybe you go camping and you get, triggered by all the pine trees and everything. So you want to make sure you take your asthma medication, even though you haven't had any symptoms, but you might not know, or you're on vacation and something triggered. So be prepared, right? And sometimes later on in life, it might come back again. So, yeah. Robert, anything that you want to add for this?
I do want to share a story if we still have some time. When I started doing asthma education like 16 years ago, I met this family. Has two kids that were like 4 years old at that time. They've been in the ER ever since, multiple times in the ER. So they came to asthma to the clinic for asthma education. I talked to them. I think I spent a little bit over an hour talking about asthma with mom, and over time we developed a good um, relationship in terms of mom listening, and not only that, but learning about asthma and learning about medication, learning about how to give it correctly, learning all of that. And ever since, I mean, I think they're around 18, 19, or 20 years old now. So they've gone through a lot of phases of different type of asthma severity. So they started out as mild persistent, and one of the older one, I think, ended up to be severe persistent, meaning he had to take a lot more medication, more stronger medication. But the point I'm trying to make is by having regular checkups, and staying in touch and keeping up with the asthma action plan, they have not seen a ER ever since then. And so, and even though in the beginning the mom was concerned about taking medication long term, the thing is, they're healthy, their asthma are much better. They've been controlled most of for those 18, 16, 18 plus years. And they're doing well as far as asthma is concerned. And then mom ended up having another child, and eventually the child did develop asthma, so mom already knew what to do. And so far he's doing great as well. But anyways, one thing that I told them, the two older kids who no longer see us because they're adults now, is that always keep up with their asthma, even though they're feeling better. Asthma does not go away; it stays with them all throughout their life. It makes, like as Lourdes mentioned, it may stay dormant, but it can come back. It may come back again later in life, or it may not. Who knows? Maybe they'll sleep forever. Asthma. Resources. So earlier, talk about when you're looking up for resources, make sure that you know they're reliable and dependable. So these are some of our vetted websites that we know. Alameda County Asthma Star Program. For those of you who are in the Alameda County, the Asthma Star Program is a program that offers in-home, basically they do home visit and they assess your home environment, and they'll provide you with asthma education as well. And they'll give you a comprehensive report about your home environment and what to and how to make that better. They will also provide you with, let's say if you have carpet, they can provide you with a vacuum cleaner, or if your area is a little bit too, dusty, they also have air purifier available. Or if you child has they may be sensitive to dust mites, they also can provide like mattress and pillow cover. So it is a good, so the program is open for Alameda County residents, children under 18 with a diagnosis of asthma. RAMP, the Regional Asthma Management and Prevention Program, they're a very good organization. They advocate for any kind of policy, laws, regulation regarding asthma. It's a good website to go and read about what they're doing in order to make our life better. American Lung Association, the Allergy and Asthma Network, and our website, UCSF Benioff Children's Hospital. Each of these websites have lots of information about asthma. As you saw, some of the video that we presented came from some of these websites. They also have a multitude of information about asthma 101, basic asthma, recognizing symptoms, triggers, all of that. Please use them. Okay. And lastly, Lourdes, you want to take this?
Yes, so handouts and brochures and forms. I know we've had questions about these availability of these handouts. And yes, so the Living with Asthma information is the handout we use at Children's for our families. It's available in English, Spanish, Arabic, Chinese, and Vietnamese. We also have the respiratory treatment medication chart available in English and Spanish. The asthma action plans, we have them available also in English, Spanish, Chinese, and Vietnamese. The low literacy action asthma plan, we will look for that in Spanish. I know we have it somewhere and make it available to us as well. And authorization for medication, we have it available both in English and Spanish for Oakland, Hayward School District, and San Leandro. San Leandro, we also included an action plan in Chinese. And then, like Robert mentioned, we have the cleaning kit recipes in English and in Spanish. So before we leave today, right, we wanted to just kind of ask, like, what will be your take-home messages, right, from today's talk? Like, what are you leaving from today that you might share with your family, you might share with your community or your families? So we really appreciate your time with us today. So yeah, so if you're able to unmute or even put it in your chat, that'll be great. Or there's a time for any questions too.
In comments. Or if you feel, you can always email us with any question, comments, concern, anytime. All right, I guess, thank you for coming to our presentation, and
Yeah, I hope you were able to continue in sharing the information with your families. And remember that the age from 3 or 4, there's where kids are more your visits, right? And you guys are in a great area of position to help families to seek medical attention if needed. Mhm.
All right, great. Thank you so much, Lourdes and Robert. We really appreciate your time today and sharing all of your knowledge. And I'm seeing all kinds of thank yous in the chat.